Hello and welcome. Today we're discussing one of the most common yet serious complications of pregnancy: hypertension or high blood pressure. Hypertension affects 5 to 10% of all pregnancies worldwide and is a leading cause of maternal and newborn complications. While it sounds frightening, the good news is that with early detection, proper management, and supportive care, most mothers and babies do well. Whether you're a healthcare student, a practicing nurse, an expectant mother, or simply someone who wants to understand this condition better, this presentation will walk you through everything you need to know. What is hypertension in pregnancy? So, what exactly is hypertension in pregnancy? It's defined as a blood pressure reading of 140 over 90 millimeters of mercury or higher, measured on two separate occasions, at least 4 hours apart. Now, not all hypertension in pregnancy is the same. There are 4 main types: chronic hypertension, high blood pressure that existed before pregnancy or is diagnosed before 20 weeks. Think of this as a pre-existing condition. Gestational hypertension, high blood pressure that develops after 20 weeks of pregnancy without protein in the urine. It usually resolves after delivery. Preeclampsia. This is the serious one. It's new onset hypertension after 20 weeks with significant protein in the urine or other signs of organ damage. Superimposed preeclampsia. When a woman with chronic hypertension develops preeclampsia on top of it. Understanding these distinctions is crucial because they guide our management approach. Signs and symptoms. How do we recognize preeclampsia? Let's talk symptoms. The classic triad is high blood pressure, protein in the urine, and swelling. Though swelling alone isn't diagnostic since it's common in normal pregnancy. But here are the danger signs every pregnant woman should know. Severe headache that doesn't go away with rest or medication. Visual disturbances, blurred vision, seeing spots, or flashing lights. Upper abdominal pain, especially under the ribs on the right side. This could indicate liver involvement. Sudden swelling of the face, hands, or feet. Decreased urine output. Shortness of breath. If preeclampsia progresses untreated, it can lead to eclampsia, seizures that can be life-threatening. That's why these warning signs must never be ignored. Risks to mother and baby. Let's talk about what's at stake. For the mother, uncontrolled preeclampsia can lead to stroke from severely elevated blood pressure. HELLP syndrome, a dangerous condition affecting the liver and blood clotting. Placental abruption, where the placenta separates from the uterus, prematurely, kidney or liver failure. Pulmonary edema, fluid in the lungs, and in the worst cases, death. For the baby, the risks include intrauterine growth restriction. The baby doesn't grow properly due to poor placental function preterm birth, often necessary to save the mother's life. Stillbirth. And long-term, these babies may face increased cardiovascular risks later in life. This is why hypertension in pregnancy is considered a medical emergency when severe. Diagnosis and monitoring. Early detection saves lives. So how do we diagnose and monitor hypertension in pregnancy? Blood pressure monitoring is the cornerstone. Every prenatal visit should include a BP check. If it's elevated, we confirm with repeated measurements. Urine testing for protein. Either a spot urine protein to creatinine ratio or a 24-hour urine collection. Blood tests to assess liver function. Elevated enzymes suggest HELL-AP. Kidney function, creatinine, uric acid, blood count, low platelets are a red flag. Ultrasound to monitor fetal growth and amniotic fluid levels. And we watch for symptoms. Remember those danger signs we discussed. Regular antenatal care is absolutely essential. Many cases are caught during routine checkups before symptoms even appear. Management and treatment. How do we manage hypertension in pregnancy? The approach depends on severity and timing. For mild hypertension, close monitoring at home or in clinic lifestyle modifications, rest, reduced stress, adequate nutrition, blood pressure medications when needed. For severe preeclampsia, hospitalization for close monitoring, antihypertensive medications to control blood pressure, magnesium sulfate to prevent seizures. This is life-saving corticosteroids if preterm delivery is likely, to mature the baby's lungs. And ultimately, delivery, because delivery is the only cure for preeclampsia. Let's talk medications. Not all blood pressure drugs are safe in pregnancy. Safe options include methyldopa, the oldest, well-studied, though can cause sedation, labetalol. First-line choice, avoid in asthma, nifedipine, very effective. Avoid sublingual route, hydralazine. Intravenous, used in emergencies, magnesium sulfate, prevents eclamptic seizures. Unsafe medications to avoid, ACE inhibitors and ARBs, these are toxic to the fetus. Atenolol may restrict fetal growth. This is critical information for any healthcare provider caring for pregnant women. Delivery decisions. When should we deliver? This is one of the most difficult decisions in obstetrics, balancing maternal safety with fetal maturity. For mild gestational hypertension or preeclampsia, we can often wait until 37 weeks or full term with careful monitoring. For severe preeclampsia, delivery is recommended at 34 weeks or sooner if the mother or baby is in danger. Sometimes we must deliver much earlier to save the mother's life, even knowing the baby will be very premature. For eclampsia or life-threatening complications, immediate delivery regardless of gestational age. This decision is always made by the medical team after weighing all risks and benefits and with the family's input. Psychosocial support and nursing care. We can't forget the emotional toll. A diagnosis of hypertension or preeclampsia brings fear, anxiety, and stress. Women worry about their baby, their own health, medical costs, and what happens next. Supportive care matters enormously. Education about warning signs empowers women to seek help. Early family involvement provides emotional support. Counseling services help manage anxiety and depression. Nursing care, teaching, monitoring, reassurance is the backbone of management. Nurses play a vital role in teaching danger signs, ensuring medication adherence, providing emotional support, coordinating care between home and hospital. Remember, a supported patient is a safer patient. Conclusion and key takeaways. Let's wrap up with the key messages. Hypertension in pregnancy is common but manageable. Early detection through regular prenatal care can prevent most serious complications. Know the warning signs: severe headache, vision changes, upper abdominal pain, sudden swelling, and seek help immediately if they occur. Treatment saves lives, from medications to careful monitoring to timely delivery. And finally, support matters. Medical, emotional, and social support all contribute to better outcomes. If you found this video informative, then like, subscribe, and share the video. Our next topic is about the hypertension, children and adolescents. Thank you for watching.